the likelihood that a child that has a cleft lip and palate needing braces, I would say it's 100%. For all the reasons of missing teeth, malformed teeth, malpositioned teeth, reduced development of the maxilla, the upper jaw. So definitely that is one of the almost certainties in cleft rehabilitation, that there will be a need for orthodontic treatment. And the treatment that is offered can vary in scope and severity, again, depending on the intricacies of each and individual child's development. So yes, long periods of orthodontic treatment will be needed. However, because braces require long-term maintenance and requires compliance with respect to hygiene, dental hygiene, the burden of care. What we generally will recommend is that treatment be tailored for each individual child, and the objectives are clearly defined from the beginning, so that we have discrete periods of treatment that will range in length from 1 to 1.5 years, sometimes a couple of years, and then treatment finishes for that stage. Child goes into retention, child goes into monitoring to kind of keep track of teeth development, and all of these factors will then determine the appropriate timing and scope of subsequent treatment. So it's not unusual that the average child with a cleft lip and palate will need orthodontic treatment over 2 stages. There are a lot of patients that need more than that, with an intervening stage, depending on how canine teeth and other teeth develop and erupt. So yes, definitely 100% orthodontic treatment will be needed. And this treatment, again, is best done within the confines of a cleft and craniofacial team, with close collaboration with my surgical colleagues, with close collaboration with the dentist members, as well as all the members of the team.